Hello, so it is me again, your wonderful course instructor or one of them for your patient education as advocacy course. Um, so one thing that I wanted us to talk a little bit about is what we mean by learning. So throughout the course, you'll see that I have kind of a combination of mini lectures, such as this one that I do, as well as um, resources that I've pulled, videos and such from other areas. Um, and then I'll have some longer lectures too when we cover things like learning theory. I might have multiple lectures or information presented on a particular day. But anyway, this one, as I said, relates to what is learning. Because if we're going to talk about patient education, we're going to talk about um, communication styles to effectively educate our patients, and um, we're going to talk about adult learning. So you'll see some of your other resources for today cover principles of adult learning. We really need to talk about, well, what is learning and what are some things that it can encompass. So learning can encompass a variety of different things, and you may be able to come up with things that I don't list here. But it it can encompass, I think, more things than we often think of when we think about learning, particularly when we think about interacting with patients in a medical setting. So, one thing that learning could be is acquiring new skills, right? So, a skill may be learning how to take care of one's wound or how to give someone an insulin shot, to give ourselves an insulin shot, right? And I think skills tend to be pretty straightforward, right? We're teaching someone how to do something that is procedural. So another thing can be acquiring new knowledge, right? Maybe knowledge about a particular um, issue that we have, a particular disease process, or something of that nature. Now, I think oftentimes we focus on procedural skills or getting people to do something, such as take their medication. We don't necessarily focus on their knowledge of why they may be taking that medication or how well they really understand their condition. So, knowledge is a really important one to consider. Another thing it could be is change in values. So, this is something that you may or may not get into as a physician with your patient. But as some examples I can think of, I have a daughter, she's 6, Olivia. You can probably see her in the background over there. Um, so, one thing that they do at her well child exams is they always give us, or at least they did until she was 6, a book at every exam. And in that way, that since we know that there's a correlation between books in the home, how much a student is read to, and their achievement, in that way they were trying to encourage uh, change in some way of the value of reading, right, and how much reading is valued in the home just by giving us a book to take home and read to her. We're a big reading family anyway. She loves to read, but um, that's one way that the medical community has attempted to change people's values related to this, something that we know is a very important predictor of later school success. Another thing that learning could be is a change in attitude. So, when you think about a change in attitude, you might think about things like smoking, for example. That's probably a big one that people deal with. Anywhere from their primary care provider, or if they do need to come in and be seen because of a condition that they have. Certainly, if there's a smoker, Or if they're a smoker, one thing that the physician will try to do is to change their attitude about smoking, and help them to understand how it may further complicate their condition or hinder their healing and recovery process. Another thing that learning can be is a change in emotional reaction. Again, this is maybe not something that you will get into as much as a physician, but you may, especially if you're dealing with a sensitive topic such as cancer. Um, and I think this can be also related to people's lack of knowledge. So one example I can think of, and I'll give a personal example, is when I was young, I was in my early 20s, I I ended up having an abnormal pap smear, which, as you probably know, is not uncommon. However, I didn't really understand what this meant at the time. So I got really scared. I got really frightened. I thought it meant that I had cervical cancer. And the person who communicated my abnormal findings to me did not do a good job of explaining that no, it did not, in fact, mean that at all. And there's a wide spectrum of abnormal, and the purpose of getting these tests is to take care of anything that is abnormal before it develops into cancer. If that would have been explained to me, I would have had a much different emotional reaction to the information I was given than I did when I thought I had cancer. So those are just some examples of different kind of learning that can take place. And as you think about your work with patients, you will want to think about um, targeting learning on those different levels depending on what their needs may be, right? And also the way that you interact with your patients and think about their learning will depend on what kind of interactions are you having with them. Are you having sustained interactions where you can really track their learning and look at whether these things are changing over time as a result of your interactions, or is it a situation in which you need to give them some instruction or form of intervention in the moment, and then be really sure that they have a grasp of the information before they leave your care. So we'll work with a variety of different scenarios and situations throughout this course, but again, keeping in mind different forms of learning and what they may look like in your patients. So just to reiterate again, it could be acquiring new skills, new knowledge, new values, new attitudes, or even new emotional reactions.